Good evening. My name is Ben Miller. I've been a hospital pharmacist for over 15 years now, and prior to that, I was a retail pharmacist. I created this video to give you the basics of doing calculations with oral suspensions and oral solutions. I don't want to take up any more of your time, so just start doing the problems, get to practice. If you have any questions, just post it in the comments. And at the end of this, at the end of all the problems, I'll give you a short lecture about suspension solutions, just some quick tips. All right, so good luck, and I hope you find this video helpful. Thank you.
Okay, we have a patient's potassium level came back low. The doctor orders potassium chloride, oral solution, 10 MEQ stat. Stat means right away. The pharmacy stocks a cup of 20 MEQ per 15 ml. How many milliliters does the nurse need to measure out? Always pay attention to the concentration. 20 milliequivalents per 15 ml is the concentration of the cup that the pharmacy has. Let's set up a ratio proportion. 20 MEQ, 20 milliequivalents over 15 ml is equal to 10 MEQ over X ml. And we're going to cross multiply 10 times 15 divided by 20 is equal to 7.5 milliliters. I like to use ratio proportion. It's just really quick to use. I'll also show you how to do this in dimensional analysis. We're looking for 10 MEQ. So with dimensional analysis, you're going to write 10 over 1 times, and we're going to put the 20 MEQ on the bottom because we want the milliequivalents to cancel out because the unit we're looking for is milliliters. Look in the question, the call of the question. So it's going to be 10 times 15 divided by 20 is equal to 7.5. And what's the unit? The milliequivalents cancel out. We're left with milliliters. Look at the call of the question. How many milliliters does the nurse need? And that's how you know when you use that, do dimensional analysis, which units you want to cancel out and which units you want to be left with. And here it's milliliters that you want to be left with. Okay, let's go to the next problem. Okay, Dr. Smith writes an order for phenytoin oral suspension. 300 milligrams PO stat used for seizures. Pharmacy stocks a cup with a concentration of 100 milligrams per 4 ml. How many milliliters, how many ml must the nurse measure out? Always pay attention to the concentration. 100 milligrams per 4 ml is the concentration. Let's do this as a ratio proportion. I like to use, if it's just a one-step proportion, I like to use a ratio proportion. So here we do 100 milligrams over 4 ml is equal to 300 milligrams over X ml. And we cross multiply. X is equal to 300 times 4 divided by 100 is equal to 12 milliliters, 12 ml. If it's a simple problem, I just like to use a regular ratio. I'll also show you how to use a dimensional analysis. So dimensional analysis, we want 300 milligrams. So we write 300 milligrams over 1 is equal, times, and we're going to do the 100 milligrams in the bottom, 4 ml in the numerator because we want the milligrams to cancel out and leave us milliliters. So 300 times 4 is 1200. 1 times 100 is 100. 1200 divided by 100 is 12. We cancel the units out, milligrams with milligrams, and we're left with milliliters. And milliliters is the unit that we're going to use, 12 milliliters. If you look at the question asks how many ml. So you know that you want to be left with milliliters at the end of the problem when you're doing dimensional analysis. Okay, next problem. The doctor writes a prescription for carbamazepine, another anti-epileptic drug, suspension 200 milligrams twice a day. Suspension is available in a concentration of 100 milligrams per 5 ml. Take a look at the bottle. How many ml per dose? How many milliliters to dispense for a 30-day supply? Okay, always pay attention to the concentration. This is a suspension, so very important. You must shake well before dispensing this. If you don't shake well, the patient's not going to get drug. So let's set up the ratio. 100 milligrams per 5 ml is the concentration that we have, is equal to 200 milligrams is what we want over X milliliters. Okay, let's do the solve for X. X is equal to 200 times 5 divided by 100. And the answer is 10 milliliters, 10 ml. Okay, so you're doing 10 ml per dose, and we're doing 2 doses a day. It's twice a day, BID. So 10 times 2 is equal to 20 ml. 20 ml is how much the patient is getting per day. Now, if you want to dispense a month's supply, like in retail, we usually dispense a month's supply for these type of medications. 20 ml times 30 days is 600 milliliters. So we would pour out into an amber bottle 600 milliliters for the patient. Okay, next problem. Lansoprazole suspension. It's a proton pump inhibitor. Doctor writes 30 milligrams once a day via G-tube. Pharmacy has a bottle, 3 milligrams per ml suspension. Don't forget to shake well. How many milliliters to give a 30 milligram dose? Let's set up a ratio proportion. So first we're going to set up the proportion. The concentration that we have is 3 milligrams over 1 ml. And we're going to do, we want 30 milligrams over X ml. To solve, we're going to cross multiply. 30 times 1 is equal to 30 divided by 3 is equal to 10 ml, 2 teaspoons. So we're going to give two teaspoons, or you can say 10 ml once a day. Proton pump inhibitor, used to treat GERD. And let's go to the next problem. Okay, patient has croup. A doctor writes a prescription for dexamethasone oral solution. It's a steroid. She wants a dose of 0.6 milligrams per kilogram for 1 dose. The patient weighs 11 pounds. How much milliliters is needed for the dose? The pharmacy has a solution of 0.5 milligrams per 5 ml. That's the concentration that the pharmacy carries. Very important. Always pay attention to the concentration. The concentration of the solution the pharmacy carries is 0.5 milligrams per 5 ml. That's the key to getting this problem correct. I quickly look at this, and we're going to do a ratio proportion first, because I prefer ratio proportions. So we're going to do 11 pounds divided by 2.2 to give us the kilograms, because we're given pounds, but the dose is in kilograms. So we get 5 kilograms. 11 divided by 2.2 is 5 kilograms. Set up the ratio of 0.6 milligrams per 1 kilogram is equal to X milligrams over 5 kilograms. And what we're going to do is we're going to cross multiply. X is equal to 0.6 times 5 divided by 1. Take out your calculator, do the problem with me, and that's 3 milligrams. So we need 3 milligrams for the dose, but we have a concentration of solution 0.5 milligrams per 5 ml, so we're going to set that up. 0.5 milligrams over 5 ml is equal to 3 milligrams over X ml. So X is equal to 3 times 5 divided by 0.5 equal to, do the calculation with me, and the answer is 30 ml, 30 milliliters. I prefer to do ratio proportion. It's 3 quick steps once you get used to it. Some people like to do this as a dimensional analysis, and we'll do dimensional analysis next, but for some reason that's just my preference. But whatever your preference is, that's fine. You'll see which way is easier for you and which way you prefer. All right, so let's do dimensional analysis next. Same thing, same question. First, we have to take care of the pounds. So we're going to do 11 over 1. And we have to convert it to kilograms times. And it's going to be 1 kilogram over 2.2 pounds. And that's going to convert the pounds to kilograms. That's our conversion factor. Times. Now we have to do the dose, which is 0.6 milligrams per kilogram. Times. And we know that it's 0.5 milligrams per 5 ml, the concentration of the solution that we have. And the units are going to cancel each other out. That's the way you want to set the units up, so they cancel each other out. 11 times 1 times 0.6 times 5 over 1 times 2.2 times 1 times 0.5. And you can multiply all the numbers in the numerator, divide by all the numbers that are added in the denominator. Take out your calculator. I'll give you a few seconds to come up with the answer. 33 for the numerator, divided by 1.1 in the denominator. 33 divided by 1.1 is 30 milliliters. 30 ml, 2 tablespoons. And that's the answer to this problem. Whichever way you prefer. And again, the units will cancel out. You're left with milliliters. The call of the question is asking you how many milliliters. So that's where you want to be at the end of the question. Okay, so the doctor writes an order for digoxin, 4 micrograms per kilogram twice a day. Patient weighs 7 pounds. The pharmacy has 0.05 milligrams per ml. How much does the technician draw out? You're dealing with micrograms, milligrams, kilograms, and pounds. So you have to make sure you do the conversions before you do the calculations. So first we're going to take a look at the pounds. 7 pounds divided by 2.2 will give you the kilograms. Whatever pounds you have, as long as you divide it by 2.2, that will give you the kilograms. So you have to know that by heart. You have to know that you divide pounds by 2.2 for kilograms. So the answer here is 3.18 kilograms. Now the concentration here is 0.05 milligrams per ml, which is the same as 50 micrograms. I did it in my head, but I'll show you how to do the conversion from milligrams to micrograms. So all you have to do is move the decimal point 3 spaces to the right. So we have 0.05 milligrams. Move the decimal point 1, 2, 3, and it gives you 50 micrograms. So the concentration on this bottle is 50 micrograms per ml. That's the ratio. 4 micrograms per 1 kilogram. We know we have 3.18 kilograms. So it's going to be X micrograms in the numerators. And we're going to cross multiply 4 times 3.18 divided by 1 is equal to 12.72 micrograms. And now we have to figure out how much of the solution we need to pull. So the concentration is 50 micrograms per 1 ml, and we need 12.72 micrograms over X ml. And now we're going to do 12.72 times 1 divided by 50 is equal to 0.025 milliliters. And that's how much you pull out to give the dose, 0.25 ml. All right, let's do this in a dimensional analysis. So again, same problem, digoxin, 4 micrograms per kilogram twice a day. The patient weighs 7 pounds, 0.05 milligrams per ml. How much ml? All right, so no problem. We can set this up. I prefer ratios, but some people like dimensional analysis. Again, you have to deal with the micrograms, pounds, milligrams. You have to convert everything to be on the same page. So let's start with the pounds. I always like to start with the pounds. So we have 7 pounds over 1. And we know that 2.2 pounds is equal to 1 kilogram. Great. And we know that we have a dose of 1 kilogram per 4 micrograms. Great. And we know that 1,000 micrograms is equal to 1 milligram, because you have to, don't forget to do all the conversions. 1,000 micrograms is 1 milligram. And we know that the concentration of the solution is what? 0.05 milligrams per 1 ml. Okay. So now we just do 7 times 1 times 4 times 1 times 1 over 1 times 2.2 times 1 times 1,000 times 0.05. And you get 28 over 110. 28 divided by 110 is equal to 0.25 milliliters. You'll see the units cancel out. Pounds will cancel out with pounds, kilograms with kilograms, micrograms with micrograms, milligrams with milligrams. You're left with milliliters. And that's what the call of the question asks for, how many milliliters. And that's using dimensional analysis. Okay, next problem. We have trimethoprim / sulfamethoxazole, 8 milligrams trimethoprim per kilogram. 30 pounds is the weight. Sulfamethoxazole 200, trimethoprim 40 per 5 ml. How many ml do we drop? Look at the bottle. It's per 5 ml. Trimethoprim 40 milligrams per 5 ml. Sulfamethoxazole 200 milligrams per 5 ml. We dose based on trimethoprim. So one of the trademarks here is sulfatrim. You also might know it as Bactrim. And always remember dose based on trimethoprim. So let's do ratio proportion. I prefer using ratio proportion, and I'll show you how to do it in dimensional analysis as well. So let's start. Start with the weight. 30 pounds divided by 2.2 will give you the kilogram weight. Get your calculator. And the answer is 13.6 kilograms. All right, so now we know that 8 milligrams of trimethoprim per 1 kilogram. And we have 13.6 kilograms. So how many milligrams? X milligrams. So we just cross multiply. We do 13.6 times 8 divided by 1. It could be a few seconds to do the calculation. 108.8 milligrams. All right, and now we know that we have 40 milligrams per 5 ml of trimethoprim in this combination suspension. We need 108.8 milligrams x ml. How many milliliters do we need? Cross multiply 108.8 times 5 divided by 40. And the answer is, what's the answer, guys? 13.6 milliliters, 13.6 ml. All right, let's do dimensional analysis. Same facts. Remember, suspension, you shake well. So let's do dimensional analysis. I'd like to start off with the weight. So 30 pounds over 1 is equal to 2.2 pounds is equal to 1 kilogram. And we know that in 1 kilogram, we need 8 milligrams. So it's 8 milligrams per 1 kilogram. And we know that we have 40 milligrams per 5 ml. You're going to see that the units all cancel each other out. Pounds, pounds, kilograms, kilograms, milligrams, milligrams. You're left with milliliters. So 30 times 1 times 8 times 5. And we're going to get the total of that. 1,200 over 1 times 2.2 times 1 times 40 is 88. 1,200 divided by 88. And that gives us 13.6 ml, 13.6 milliliters. And that's the answer to this question using dimensional analysis. Again, shake well. Remember that we dose based on the trimethoprim component, not the sulfamethoxazole component. If a patient has a sulfa allergy, that's something, this is not the drug for them. Okay, let's go to the next question. Okay, for those of you working in retail, we have cephalexin, 250 milligrams per 5 ml twice a day for 10 days. How much should the pharmacy dispense? How much water do you use to reconstitute the bottle? What are the directions written on the label? What auxiliary label should be used? Okay, so you have cephalexin, generic name. Keflex is the brand name. It's a cephalosporin antibiotic. So how much do you dispense? So we have 1 teaspoon. You have to know that 1 teaspoon is 5 ml. That you must know. You must commit that to memory. BID is twice a day. B is the second letter of the alphabet, so think twice a day. So 5 times 2, because it's teaspoon twice a day, is 10. And as you're taking for 10 days, it's 100 ml. So you're dispensing a bottle that's 100 ml. Because these bottles they come in different sizes depending on the directions. You'll see they usually come in 50, 75, 100. And it all depends on the medication. Some come in 150, So look at this bottle, 250 milligrams per 5 ml is the concentration. Always look at the bottle, very important. People have worked for years and sometimes they're so busy and they don't pay attention. Add 67 ml of water, look at it, it's on the back of the bottle, it tells you. 67 ml of water is what you add to this bottle. And when you shake it, the powder takes up volume also. And you also have to refrigerate, and it's only good for 14 days. And you shake well before use. So look at the label. All the information you need is on this label. The powder takes up some volume, so when you add water to it, that's why it comes up to 100 ml. So again, 67 ml is what you use to reconstitute this bottle. Usually you pour half of the 67 ml, shake well, then add the remainder of the 67 ml, and that's how you reconstitute. Usually reconstitute when the patient comes to pick up the medication, because you don't want to do it too early because the expiration date starts once you mix it with the water. It's only good for 14 days once you mix it. So you want to make sure the patient is in the pharmacy before you mix the medication. Very important. Also very important to note that it's only good for 14 days. So you want to put all those auxiliary labels on there. So the first important fact that's going to be on this label is the directions. Take 1 teaspoon twice a day. BID, 1 teaspoon twice a day for 10 days. And that's the direction, 1 teaspoon twice a day for 10 days. Okay, next, the auxiliary labels. Again, take a look at this bottle, refrigerate. So we're going to put a refrigerate sticker. Once this bottle is mixed with water, you have to keep it in the refrigerator. Shake well. This is a suspension. If you don't shake it well, the drug is going to be on the bottom, and all you're giving the patient is water. Always shake suspensions well before you draw out the dose. Very important. Discard after 14 days. After 14 days, as long as it's refrigerated, it's good for 14 days. After 14 days, you discard the medication. Very important. Next question. Most antibiotics in the pharmacy come in 50, 75, and 100 ml. Let's look at amoxicillin, 400 milligrams per 5 ml. Half a teaspoon is 2.5 milliliters. BID means twice a day, 2 times. So 2.5 times 2 equals 5 times 10 days is 50 milliliters. That's how much you would dispense if these were the directions. 3/4 teaspoon is 3.75 milliliters. BID again is twice a day. So that gives you 7.5 milliliters. Times 10 is equal to 75 milliliters. So you would choose a 75 milliliter bottle. 1 teaspoon is 5 ml. Twice a day times 2 is equal to 10. Times 10 days is 100 ml. Then you would choose the 100 milliliter bottle to dispense. And I'm going to show you some pictures of what these bottles look like.
Okay, I hope you enjoyed the video and learned something. I just wanted to make a couple quick points. Always pay attention when you're dealing with liquid medication. Are you dealing with a suspension or a solution? So if you're dealing with a suspension, you always have to shake well, very important. If you don't shake well, the drug is at the bottom of the bottle and you have to shake it. And once you shake it, the drug gets distributed throughout the bottle, and that's when you withdraw the dose. If you don't shake well before you take the dose out, you're not giving the patient any medication, you're just giving them whatever the suspending agent is, usually a syrup, or in case of antibiotics that you reconstitute with water. So again, always shake well. If you don't shake well, you're not giving the patient medication. So if you're doing a suspension, shake well. Solutions, that the drug is dissolved in solution, so you don't have to worry. Take note, some of the liquid medications are refrigerated, some are not refrigerated, so pay attention what goes in the refrigerator, what doesn't. If something needs to be refrigerated and you don't refrigerate it, then that can affect how long the medication is good for. Let's see, again, always pay attention to concentration. When doing these problems, if you know the concentration, that's already 95% of getting the problem correct. So it's very important to know the concentration. Most antibiotics come in powder form and you have to reconstitute them. So if you're in retail, you'll probably do this a lot. You'll reconstitute the bottle before the patient, when the patient comes to pick up the medication. because once you reconstitute that bottle, then the expiration date usually is only good for 14 days on most of these antibiotics. Most of them are refrigerated after they're reconstituted, so just pay attention which are refrigerated, which aren't. So when you put on your auxiliary labels, with these antibiotics, it's usually going to be shake well, refrigerate, and the 14-day expiration. Again, not every antibiotic is refrigerated that's reconstituted. Most are. Okay, so if you have any questions, again, just post it in the comments section. If you have any other problems you want me to work on and make a video of, I will. If you found value, please like and subscribe, and good luck. Thank you.